Good morning. My name is Holly Bowens, RNFA, CNOR, TNCC. I'm a member of the Desert Regional Healthcare Alliance's Prevent a Second Stroke team, or PASS. I'm here today to give you an in-service on CVA stroke survivors. The presentation goals are, at the end of this presentation, team members of the CVA Survivor Prevent a Second Stroke or PASS team will be able to identify the population at risk for a stroke, including the pathophysiology, comorbidities, and lifestyles. Identify typical symptoms of a stroke and differentiate between ischemic and hemorrhagic strokes. State some evidence-based treatments, including pharmacological and non-pharmacological or complementary therapies for stroke patients, and collaborate with a multidisciplinary team regarding the health promotion and risk reduction goals of the stroke survivor. The overview of a stroke survivor population is in the United States. Stroke is the fifth leading cause of death, with over 200,000 each year. There's an estimated 800,000 new cases each year of stroke, and about 616,000 are primary or first-time strokes, and 185,000 are recurrent strokes. Stroke's the leading cause of disability for adults in the United States, and strokes affect the economy at the macro level in the United States by about $72 billion each year. The most common age of a patient with a stroke is 55 to 64. However, it can happen anywhere between the ages of 40 and 90 for adults. It can affect either male or female. Males usually have strokes at an earlier age and the females at an older age. The most common race of people that have strokes are the African Americans. And if you have a history of a previous stroke or a TIA, you're more likely to have another one. The comorbidities and lifestyles that can attribute to a stroke is hypertension or hypotension, diabetics with HbA1c of over 6.5, high cholesterol, that includes the triglycerides. If you have sickle cell disease, if you have atrial fibrillation, because that can be due to blood clots in the heart. Obesity, if your BMI is over 25. If you're a current smoker, an alcohol abuser, or if you are an illegal drug user. The national safety goals for a stroke patient is time is tissue. So you've got to initiate early access to care. Usually the time from the door to the doctor should be 10 minutes. Then you need to have early access to the CT scan. The goal for that is 25 minutes from coming to the hospital. The speedy diagnosis would be, we need to have the CT scan read within 45 minutes of it being completed. Early intervention of drug therapy should be from the time you get to the hospital to the time the drugs are started should be 60 minutes. And supportive care to minimize the disability would be, you need to be in a monitored bed within 3 hours of getting to the hospital. Health promotions and risk reduction goals and interventions are preventing a stroke starts with living a healthy lifestyle. So you need to be on like a Mediterranean diet, which is eating fresh fruits, vegetables, nuts, whole grains, omega-3 rich fish, and try to avoid all saturated fats. Patients' blood pressure, glucose, and cholesterol needs to be monitored, and they need to be sure and take the medication as prescribed by the physician. It's recommended that the patients quit smoking cigarettes and quit illegal drug use. They need to limit their alcohol consumption to 1 alcoholic drink per day for females and 2 for males. They need to exercise regularly and maintain their ideal body weight so that the BMI matches up to their height. And rest is so important. So they need to get anywhere between 7 and 8 hours of restful sleep each night. The overview of the pathophysiology of the stroke is the first one is the ischemic stroke, where a clot lodges in the brain and blocks the blood flow. It can either be a blood clot or plaque that blocks these vessels. It causes a lack of oxygen and nutrients, which causes the cell death. And the cell death creates ischemic area or areas in the brain, which ultimately results in the loss of function. The hemorrhagic stroke is either an aneurysm that ruptures or a weakening blood vessel that leaks, which is usually associated with hypertension. Or it could be caused by a trauma, which would be a fall, or if they sustain a blow to the head, which causes some bleeding. This bleeding is contained in the skull, which causes pressure and cuts off the blood flow to the area, depriving the cells of the oxygen and nutrients. This restriction of the blood flow causes a death to the tissue and will result in the loss of functions. The typical symptoms that you'll see of a stroke patient is that common symptoms are hemiplegia and confusion, which loss of memory can be short-term, doesn't remember what happened. Vision changes, which can be in one eye or just blurred vision in both. They'll have a sudden severe headache of unknown cause. Their speech is sometimes slurred or changes, and they'll have gait changes. Usually the acumen of FAST is used to diagnose these patients. The F is for face. Have the patient smile. Just one side of the face droop. They can show their teeth to you to see if one side doesn't raise. The arms. Have the patient raise their arms and does one of them drift downward. The speech. Ask the patient to repeat a simple phrase like, "You can't teach old dog new tricks." And note if there's any slurring or graveling of the speech, or sometimes they can't even swallow. They'll have the dysphagia. And the T is for time. Find out when these symptoms first started, because like I said earlier, time is tissue death. The NIHS recommends doing a complete neuro exam, which can be the Glasgow Coma Scale and the NIH Stroke Scale. These all help aid with the rapid assessment of these patients. Laboratory and diagnostic data for these patients is they're going to need to have baseline studies done, so we'll need to know a CBC, the coag studies, the lipid profiles and chemistry, the BUN and creatinine, see if their kidneys are working, and the blood glucose level, which is important. We need to maintain glucose levels. Imaging studies, of course, they're going to need an emergent CT scan. They could have an MRI or a carotid Doppler study done, or a cerebral angiography. The additional studies that are recommended is a baseline EKG, and a TEE is very helpful, especially if the patient has a history of AFib. The holistic therapies for the pharmacology part is an antithrombotic to reduce the clot formation, antiplatelets, which will reduce the thrombus formation. They need to be on an anti-diabetic medication to lower the blood sugar levels. Antihypertension, we got to keep the blood pressure levels within normal range. These patients may have a seizure, so they may be on an anticonvulsant. The diuretic can help get some of that fluid off of them. These patients there's real common for them to have depression, so a lot of times they're on an antidepressant. They're on an anti-hyperlipidemic to lower that cholesterol levels. They could be in pain or discomfort, so they'll need an analgesic. It's usually recommended for Tylenol. So that if you give them ibuprofen, that's going to be a blood thinner. They're probably already going to be on one. So To prevent increased intracranial pressure, we don't want them to do any straining or do a Valsalva when they're going to the restroom, so they need to be on a stool softener. And a lot of times they have trouble sleeping, so they're going to be on a sedative. The non-pharmacologic or holistic therapies, there could be on acupuncture, which helps with the pain by blocking the nerves. To help with relaxation, they could have aromatherapy. Massage therapy and reflexology helps with relaxation and muscle contractures, and meditation and relaxation helps with the relaxation and their overall well-being. And yoga helps with their balance, their core strength, and their flexibility. The collaborative outcomes for the health and well-being is the goals for this multidisciplinary team is to recognize the signs and symptoms of a stroke, provide speedy emergent treatment, provide specialized care in this acute phase, help the patients by early physical and other rehabilitations, and to educate the patient, family, and community on stroke signs, symptoms, and prevention. A stroke can be a devastating event in a patient's life, but through the use of an interdisciplinary team, speedy recognition of the symptoms and interventions, hard work by the patient, family, and community support, a person can be on the road to recovery. I want to take this opportunity to thank you for your time and attention today. I have an e-poster for y'all at the back of the room, and I look forward to working with y'all on this important team. I hope you have a great day. Thank you.